It's about 12:05, so why don't we get started? We're going to have just a quick intro from Peter Cusick, our COO, and then Lisa Ullman, our health policy advisor, is going to go over a presentation explaining the Climate Action Premium Credit Program, and then if we have time at the end, I'll field some Q&As. So with that, Peter, I'll kick it over to you.
Thank you, Melissa. Good afternoon, everyone. Welcome to NYSIF's webinar on our Climate Action Premium Credit Program for hospital systems. I'm Peter Cusick, Chief Operating Officer for NYSIF, and on behalf of our entire team, I'd like to thank you for taking the time to join us. It's terrific to see so many members of our producer community participating today, as we're excited by the opportunities the Climate Action Program offers policyholders and their workforce by supporting the reduction of emissions and enhancing their resilience. Most of you are familiar with NYSIF as the largest workers' comp insurance insurer in New York. We cover approximately 2 million New Yorkers and work with over 200,000 employers engaged in industries throughout New York. By statute, we have a public mission. We protect the workforce by ensuring employers have access to high-quality coverage at the lowest possible cost. NYSIF utilizes our unique role in the marketplace to serve as a leader in promoting workplace safety. Policyholders are provided free of charge at the benefit of their policy with a variety of safety resources, such as our online library of safety training programs, our safety consultancy program, and certified OSHA training. Now, with the NYSIF Climate Action Program, NYSIF is ensuring that we can use insurance as a lever for addressing the health risks and workplace safety concerns related to the hazards of climate change. In a moment, you will hear from Lisa Ullman, NYSIF's health policy advisor, who will discuss the findings of the study NYSIF conducted on the impact of extreme heat on workplace claims. These results led us to explore how NYSIF could support its insureds and its covered workers to reduce these risks. Climate Action Credit Program provides direct support to our policyholders to manage workplace risks associated with climate change and incentivizes employers to invest in reducing emissions and bolstering resilience to climate-related hazards. I'd like to now introduce Lisa Ullman to discuss our study on extreme heat and the Climate Action Premium Credit Program. Thank you, Lisa.
Great, thank you, Peter. Hello, everyone. I am going to share a few slides that provide some more information about how our program works. But as Peter said, let me first give you a little bit of background on why we undertook this initiative. So more and more, we have been looking at our data to understand how we can help improve worker health and safety. And we know that climate change is a threat to human health. And when we talk about climate change, we are talking about how the excavation and combustion of fossil fuels has led to an accumulation of greenhouse gases in the atmosphere, and that's increased global average temperatures substantially over pre-industrial levels. Increasing temperatures cause rising sea levels, extreme weather events, and natural disasters like droughts, floods, and wildfires. And the outcomes like extreme heat, poor air quality, more frequent and intense storms have a tremendous impact on human health. They cause or exacerbate physical illness and injury. They have mental health impacts as well, and they impact access to care by damaging hospital infrastructure and disrupting the availability of goods and services. And in addition to these impacts on human health, we see in the literature the impact on worker health and safety. And we wanted to explore this further by looking at our own data. And we decided we were going to focus on extreme heat. So we looked at approximately 95,000 workers' compensation claims, and we looked at heat index data for the days on which the underlying injuries occurred. We saw that claimant injuries were 45% more likely to arise on days when the heat index exceeded 80 degrees. And those injuries were 20% more severe based on our average medical expenses incurred for those claims. Both the probability and severity of those claims increased as the heat index rose. These findings do show a strong correlation. Doesn't necessarily show causation. We're looking at our data in further detail on that, but there's definitely a really strong association observed between extreme heat and worker safety, and that's consistent with much other published research. So that made us think, how can we at NYSIF help our policyholders reduce the workplace hazards associated with climate change? We developed our premium credit program as a result, and ultimately we're going to make this program available to all of our policyholders in all industries. But we decided to start with the healthcare industry, and in particular, we thought we would start with hospitals, and that's because healthcare providers have to deal directly with the health impacts of climate change as it impacts their patients. They also have to manage the system disruptions that arise because of climate change. And at the same time, the healthcare sector, particularly hospitals, contributes significantly to greenhouse gas emissions. The connection between climate change and health is getting a lot more attention these days. So we believe hospitals are thinking about this more and more. It's something that the United States Department of Health and Human Services has highlighted. HHS has a voluntary pledge program where participating healthcare entities commit to reducing their greenhouse gas emissions. And also HHS emphasizes the importance of focusing on resilience. Other influential groups like the National Academy of Medicine and the New York Academy of Medicine are focusing on this. The Joint Commission, which accredits hospitals, has a new sustainability certification for hospitals as well. So all of this led us to start our initiative with hospitals. Now, the program was designed to help hospitals manage the workplace risks associated with climate change, and it's available on a voluntary basis to hospital systems that already have workers' compensation policies with NYSIF, or they can become policyholders in the future. And there are three components to the program. So first, hospitals can access a premium credit as soon as they take our pledge, committing to develop a climate action plan. Second, they can continue accessing that credit in the next year when they submit their climate action plan. And in future years, as they report progress in implementing the plan, they'll continue receiving that credit. Third, NYSIF has a strong risk control team that can provide support to hospitals as they develop and implement their plans. That support includes, for example, training materials and a learning forum. So let's walk through each of these components in a bit more detail. So the program provides hospitals a one-time upfront credit of 5% on their workers' compensation premium, up to $1 million per policy, when the hospital pledges to reduce its greenhouse gas emissions, enhance its resilience to climate-related disruptions, and develop a climate action plan that describes the ways in which the hospital is going to meet those goals. The pledge form is very simple. It's one page long. It's available on our website for you to take a look at. Now, in completing the pledge form, hospitals have to select one of two numeric standards that they're going to work towards. The first one is derived from the New York State Climate Act. So basically, if a hospital selects that standard, they'll be working to try and reduce their emissions 40% by 2030 and 85% by 2050 from 1990 levels. The second numeric standard they can choose is the standard that is used by the Federal Department of Health and Human Services in their pledge initiative, and that's a reduction of at least 50% by 2030, achieving net zero by 2050. So again, the hospital gets to select which of these standards it's going to work towards. Now, the idea of these upfront credits is to free up funds that the hospital can use for its climate action planning, and the hospital will have 10 months to develop and submit the plan. So after they take the pledge, they take those 10 months to work on the plans, and that will enable them to continue accessing the premium credit in the second year. So as soon as they submit that plan, they're now eligible to continue with that credit. Now, what do those plans look like? We recognize that hospitals have a lot of competing demands and requirements, so we're not imposing specific strategies on them. We want them to have the flexibility to determine what works best for them. However, we do expect to see certain overarching elements captured in the strategies that they choose, and you can see them outlined on this slide. So first, we ask that a hospital designates a project lead as part of their climate plan. We're not requiring that they hire an FTE for those functions, but this is someone that will oversee the implementation. It provides us with a contact, and it also serves as evidence of the hospital's commitment to carrying out the plan. Second, we are looking for the plan to include a baseline emissions inventory. So an inventory of the current level of greenhouse gas emissions emanating from the hospital's operations. And we do require that this be attested to by an independent third party. That attestation can be made by an independent certified public accountant, an independent licensed public accountant, or a greenhouse gas emissions attestation provider that has experience in measuring, analyzing, reporting, and attesting to greenhouse gas emissions. So the idea is that the plan needs to include that baseline emissions inventory accompanied by that attestation. The third thing we'll be looking for is a framework for measuring and monitoring both direct and indirect emissions. And that's important. We want them to be thinking both about the emissions that they directly generate, for example, from using fuels in their boilers and furnaces and the vehicles that they own, as well as the anesthetic gases that they generate. But we also want hospitals to be thinking about the emissions that are indirectly generated in the supply chain, like purchased goods, single-use plastic medical and surgical supplies, food and waste, transportation that's used by employees who commute and used in actually bringing supplies in. So we want the plan to reflect a framework for measuring and monitoring all those emissions. Fourth, we are looking for that climate action plan to specify how both those direct and indirect emissions will be reduced. And we're expecting that this will include ways that the hospital will encourage measurement and monitoring by suppliers and vendors. So we're expecting to see the hospital describing plans to prioritize procurement for entities that are willing to engage in monitoring and measuring their own emissions. And again, we're not telling them exactly how to do this, but these are the types of strategies that we expect to see in the plan. And we do recognize that reducing indirect emissions can be challenging. So an acceptable plan doesn't necessarily have to anticipate reducing indirect emissions in the initial years of implementation, but we do want to see strategies for achieving those reductions over time. The fifth thing we're expecting to see in the plan is a focus on resilience. So extreme weather events, as we said, can damage hospital infrastructure, and it can disrupt a hospital's ability to provide the critical services to the surrounding community. And those events can disrupt services by also causing a break or a delay in the supply chain. So it can interfere with the flow of medical equipment, pharmaceuticals, other supplies coming to the hospital. So we're expecting in the plan to see some assessment of the hospital's readiness to recover from events like these. So for example, tell us where are the vulnerabilities in your supply chain. And we want to see contingency plans so that the hospital and its workers can withstand and recover from these events and continue serving the community. The next thing we're expecting to see in the plan is a focus on education and outreach. We're expecting hospitals to train their own staff on their climate action plan, highlighting to them why they think it's important and getting their buy-in. And we also want to see that there is some outreach to patients and the surrounding community. So we really think that that commitment will really help the hospital carry out the plan, and also will help the hospital serve as a leader to help inspire climate action efforts in the surrounding community as well. And finally, we just want to make sure that the hospital is going to monitor implementation of this plan over time. It's important to make sure that the plan is achieving the positive impacts for workers and patients, as well as the local community. And if necessary, adjustments will have to be made over time as well. So we want to see the plan reflect a commitment to do that as well. So that's what we are looking for. Again, I want to highlight, we are offering flexibility in how the hospital goes about achieving these things, but these are the overarching ideas that we want to see reflected in the plan. And in future years, hospitals will continue being able to receive the premium credit. Again, this is a credit of 5% up to $1 million per policy. And this will be available each year that the hospital makes progress carrying out its climate action plans. So they'll submit an annual program update to us, and that update will again need to include a third-party attestation verifying the current emissions levels. As long as they are making progress implementing the strategies, hospitals will be able to qualify for the ongoing credit. And we know there are going to be maybe possibly some years where they can't show as much actual progress. Perhaps they can't show the emissions reduction level, but and that may be for reasons beyond their control. But we definitely need to see that they have strategies, strong, sound strategies, and that they are evincing good faith efforts to carry out the progress and move that climate action plan along as it's designed. As I mentioned, we also offer here at NYSIF risk control services. It's available to all policyholders. We offer consultation, resources, and training, and the idea is that it helps our policyholders understand how they can promote worker safety in their workplaces. We have added a focus on helping hospitals reduce the workplace hazards posed by climate change. Now, we're not going to write the plan for hospitals, but we can provide them with some technical assistance to help them in both developing and implementing their plans, and we can point them to relevant resources. We can also offer some extra assistance for smaller hospitals who may be struggling even with the premium credits to undertake planning and implementation, so they can certainly ask us for that help. We also will be convening a voluntary learning forum for hospitals so that they can learn from each other's experiences. So this will involve periodic web-based meetings. We anticipate bringing in guest speakers, having our own risk control experts speaking, and again, pointing to resources that can help hospitals in this work. Now, let me just explain why we think this is so important to hospitals, why we think this is appealing to them. I mean, again, our goal here is to help them manage the workplace risks associated with climate change. By incentivizing action to reduce their emissions and enhance their resilience, this program will help them mitigate the climate-related environmental hazards that otherwise are going to contribute on a continuous basis to the frequency and severity of injuries, as well as workers' compensation claims. So we think this is something that hospitals want this help in managing those risks. And by offering upfront credits, we are freeing up funds for climate action planning. So again, hospitals get the benefit of that credit right off the bat, and then they'll have 10 months to work on their plans. This is going to be particularly helpful for hospitals that so far haven't really been able to engage in any climate planning at all, but it also works to help hospitals that are further along in that journey to continue working on those efforts. The program, as I said, does not impose any specific strategies on hospitals. It allows them the flexibility to design and carry out their plans. And as long as they are making progress implementing the strategies in their plans, they will be able to qualify for the ongoing credit. As we talked about, access to risk control services, including the Learning Forum, are going to offer assistance to hospitals in developing and implementing the plans. The ongoing credits are also going to be amplified when hospitals access other funding that might be available, for example, tax credits that are available through the Inflation Reduction Act. We also think that participating in our program will better position hospitals to qualify for the Joint Commission's new sustainability certification, which again, we think is something that will appeal to a lot of hospitals. Over time, we are expecting that reduced emissions will result in cost savings for hospitals, and they can use those savings for patient care and to further enhance their resilience. And we also think that participating in the program is a statement to employees, the hospital's workers, that the institution cares about their health and well-being and wants to do something about it. We have a dedicated web page about this program. You can find it at, as you see here, NYSIF.com/climate credit. And you can find more information about the program. You can see the pledge form. You can also see our report that provides more information about the heat analysis that I talked about earlier. Like I said, the pledge form is on that page as well. And you can see on this slide, we have an email address where you can send any questions you think of after we conclude here today. Climate Action Program, all one word, at NYSIF.com. And now let me turn things back over to Melissa Jensen.
Thank you so much, Lisa. That was wonderful information. Okay, so now we have a little bit of time left, and we were going to open it up to questions. There is a Q&A feature in this webinar. You can probably see it at the top of your screen. So if you do have a question, please send it in. Happy to answer anything. Let's talk about eligibility for the program. So who is eligible? So Lisa mentioned this is eligible. The eligibility is for our hospital policyholders. It's available to hospital systems that have a workers' comp policy through NYSIF. So just to be clear, whether they're an existing policyholder or a new policyholder, they will get the credit. A hospital system means that an entity that includes at least one facility licensed in New York State Department of Health as a general hospital. So that's the specifics on who is eligible. Okay, let's go over when the credit's available. So the initial upfront credit is available right after a hospital signs a pledge. I think Lisa mentioned that. It will continue to the next year. The hospital does have to submit their climate action plan within 10 months. They'll get their credit for the next year, and will keep going on as long as they are making progress on their climate plans. Okay, so we have when do we expect the credit to be available to other industries? That's a great question. Lisa and I just recently had a conversation about this. We do plan on rolling it out. We have to come up with a rollout strategy, which Lisa and I are working on. So I can't specifically say the date that it will be available, but as soon as we have that information, we'll roll it out. We are looking at this. Thank you for that question. I know Lisa did such a good job at explaining the program. Nobody has any questions, so that's okay. We do have, I think Lisa shared an email address that we have. If you do have questions, hold on, let me see. Oh, sorry, I missed one. Will a report template be available? We are working on, yes, we're working on a template right now to help out. Lisa drafted it, sent it to the team. We're just waiting on one more quick edit, and then we will get that out shortly. So we do want to make this as easy as possible for everybody who participates. Okay, so I do encourage everyone to go to our website. We do have a web page. I think Lisa mentioned it at the end of her presentation. We do have a website on NYSIF.com. You can go read our report. We put a report out on this. We have guidance about the program. Our website does have the email address that you can email to if you have any additional questions after we close out today. You can send it and somebody will get back to you. There's about 10 of us monitoring that email box, so somebody will get back to you shortly. And I think with that, we can wrap up and give everybody a half hour back. Peter or Lisa, did you want to add any final comments?
I just wanted to thank Melissa and Lisa for a wonderful job in this presentation, and thank everybody for joining us today. It's Friday afternoon, but this is a program that we're very excited about. We think it's going to be a tremendous benefit to our policyholders, to the workforce. It's going to address issues that are of primary concern today. And as both Melissa and Lisa have said, we are here to answer whatever questions may come up. Please use our resources on the website. We will make a version of this available, this webcast available. And we are here to answer any questions you may have. So thank you so much for everyone who joined us today.
All right, thank you. Everyone have a great day.